And future nurses, welcome back to my YouTube channel. And on today's episode of Nurse Clement B, I'm going to teach you on how to carry out cold test for glucose. That is glucose test. This test is mostly carried out on diabetic patients. So as a student nurse, as a nurse, you have to get this knowledge at the tip of your fingers, these skills, right? So during OSCE, you don't have to struggle, or during your professional promotion exams, you don't have to struggle trying to get these skills at the tip of your fingers or trying to pass the exams. So this video is going to be very helpful to you. Don't forget, always share my video, like, share and subscribe. Watch this video to the end. It will help you. Both the midwives, students, no students, midwives, please watch this video. And I love you all. I love you all for watching my videos, for subscribing to my YouTube channel. Please keep it up. I love you all. So the next thing, when you are carrying out glucose tests, remember that the glucose test is being divided into two main headings, right? The physical examination and the chemical examination of the urine. So you have to start with the physical examination first. But before we do that, let's go and perform hand hygiene first. So if you perform hand hygiene, remember it has marks when it comes to OSCE. Performing hand hygiene and donning your gloves is important, right? So let's go and perform hand hygiene. Follow me, right? So it's important that after washing you and drying your hands, after washing your hands with soap and water, make sure that you dry your hands properly. If not, during exams, I used to find some students, they'll be struggling and struggle just to put on gloves. That is somehow time consuming. So it is important that you dry your hand properly before you do that. Okay, the next thing is for you now to put on glove. Remember, you are doing you are carrying out a procedure that has to do with the bodily fluid of a patient. So it's important that you glove your hand so that you not contaminate yourself with the specimens, right? So that you not contaminate, so that you not contact disease like hepatitis and other bodily fluid diseases. So the next thing is, remember I told you it's divided into two main headings: physical examination and chemical examination. So the first thing you will do is that carry out the physical examination. Do not forget that during exams, you don't have to like waste your time picking it one after the other to do physical examination. I'm telling you, you can use even 30 seconds to do physical examination with this urine. Just 30 seconds. 30 seconds is enough. For example, you just carry the urine, look at the deposits, look at the color, the amount. Make sure that you place it on a flat surface, and then the odor. So you can do that within a short period of time. I used to tell my students that whenever you want to carry out physical examination, I used to give, during our time, they used to tell us that we can use this acronyms DOCAS, and then get your physical examination and sometimes the chemical part of it. So you can just write, take your paper, write your D, capital D, capital O, capital R, capital C, A, and S. So this will give you a guide for you to, as I said earlier on, the DOCAS will give you a guide. This acronym DOCAS, it will give you a guide so that you will not forget what you want to do, right? So as you've written D, that D stands for deposit, O stands for odor, R reaction, C color, A amount, while S stands for specific gravity. So as you've written this, it will help you not to forget. So as I said earlier, that you can carry out this physical examination within some seconds, like 30 seconds. For instance, now you pick the beaker, we start with the D, check deposit. Of course, this urine, it has some particles. As you can see, it has some particles inside. So you note, is it blood, is it mucus? So you note them, right? So the next thing is for you to check the Odor. You bring the urine close to your nose and perceive the odor. Don't forget that the odor is it's aromatic or characteristic smell, right? So the next one is for you to check the color. Of course, the color of this urine is amber. Is amber, and then you check the amounts. For amounts, you don't have to carry the beaker in your hands. You just allow it in a flat surface like this. Make sure that the graduating side, this graduating side, the numbers is facing you, is towards you. Then you check, turn it towards your side, allow it to settle. Please don't touch the table. Don't allow it to shake, so that you can be able to get the accurate amount of the urine that is inside the beaker or the patient produces. So I'm checking now. The urine is about 210 mils. As you can see, it's about 210 mils. Look at it. It's slightly above 200. So I've noted the amount. So the deposit, yes, I can write deposit present, and then odor aromatic, then reaction. I will leave reaction to maybe litmus paper to check the pH, or I will use the test strip to check that, because some test strip, it has the pH that you can check. It has the space for pH for urine. And then amount, I have my amount is 210 mils, right? And then color amber. So I've not my physical examination. Please don't forget that all these things that I'm doing, all this, I didn't stain my hand at all. I didn't have direct contact with the urine. So that's why I'm writing. I can be able to note what I have done during the physical examination of this urine. So it is important that you don't allow your hand to touch the urine, right? So now I'm going to check I'm going to continue with the chemical examination of this urine, right? I'm done with the physical examination of this urine. So to do the chemical examination of the urine, you have to use this strip. Do not forget that when you want to do the chemical examination of the urine, you have to follow the manufacturer instruction. Also try to check the expiration date. Look at this. It's not expired. It's going to expire 2025. It's going to expire April 2025. So you check the expiration date. You also check, is this combi 2 or combi 9? Which one are you going to use? For example, if I'm going to carry out glucose and protein, I will only use combi 2. There is no need of me using, look at this, it's combi 2. There is no need of me using combi 9. Look at it. It means that you have like 9 chemicals for you that you can test, while this one is all 2 chemicals. That's combi 2, only glucose and protein. Well, likewise, this one is combi 9 too. You can use it has 9 chemicals that you can test at the same time. So the next thing that you're going to do is to get your urine. Get the urine. Permit me to keep my urinometer here. Get the urine that you want to test. We'll draw some amount of urine and put it inside the beaker and inside the test tube, inside the test tube. We'll draw. So I'm going to use this test tube to do specific gravity and the remaining chemical examination of this urine, right? So let me add some more. And I will discard it. I will discard, it's much because I'm going to use it for specific gravity. Let me add this. So Make sure that you put it at flat surface. So the next thing is for me now to use Combi9. So I choose to use Combi9, right? I'm going to use this particular one. Immediately you open, you take one strip, close immediately, as I have done this way. So dip it inside the urine for some seconds and remove excess urine by rubbing the strip around the edge of the test tube. So you pick the same container. Don't forget, you have to follow manufacturer instruction, right? So you come close, check, put it this direction, look at it. Nitrates 60 seconds, urobilinogen is 60 seconds also, protein 60 seconds according to this manufacturer, pH 60 seconds, blood 60 seconds, ketones 45 seconds, bilirubin 45 seconds, glucose 45 seconds, and ascorbic acid 45 seconds. So you start with the seconds, then time that is the lowest time. So the lowest time now is 45, from 45, 5, 45. So had it been we have 30 or 15 seconds, we start with 15. But we're going to start with 45 according to this manufacturer. But according to this manufacturer, please do not always assume. According to this manufacturer, you see, glucose is 30 seconds, blood 60, pH 30, right? Protein 30. While for this manufacturer, it's not the same time. So always follow the manufacturer's instruction. So you have to place it this way. Do not allow it to touch the container. Follow this way. Compare the colors. So now we are comparing to get our result. Remember, during OSCE, they will put instruction by saying carry out a specific they will just put instruction like carry out a cold test or glucose test on the specimens before you. So you have to do what the instruction says, right? So now it's glucose test. We are focusing on glucose test. So we are only going to check the glucose, right? So that we can pass the OSCE, that which is being set before us, right? So I'm going to check now. It's 60 seconds according to this manufacturer, 60 seconds for glucose. So I'm trying to locate glucose. Glucose is 45 here. As you can see, 45 seconds. So you can see it's negative, right? As you can see, because the color matches with this one, which indicates negative, as you can see. So had it been there is trace of glucose, it may be this color. Then the next one plus, two pluses is what this color, like slightly nude color. So for this specimen, there is no glucose, so the glucose is negative. So now I am done. And also you want to check the pH of the urine. For this type of Combi9, there is pH where you can check the pH of the urine. Of course, look at it. But for this one, you cannot check the pH, right? So it's fine. Since we are going to use this, then we are done. The glucose is negative. Then we discard it into the bin. So the next thing for me now is to check the specific gravity of this particular urine. So for us to check the specific gravity of this urine, you have to use urinometer, of course. Remember, urinometer is being graduated with numbers from 1.00 to what 1.060, and normal specific gravity of urine starts from 1.00 to 1.030. So now we want to check the specific gravity of this urine. How can you achieve that? You have to dip this urinometer inside this test tube. Always get a test tube that the urinometer can go in straight comfortably, right? So you dip it in this way, straight. Make sure that you put amount of urine that will not spill neither with the urinometer touches the base of the test tube. So always make sure that the urinometer is floating. Do not allow the urinometer to like touch the edges of the test tube, right? So you have to put it this way, allow it to float. See, look at it now, it's floating. It's not touching the base of the test tube, and also it's not touching the edges of the test tube. So now permit me to read. So you read it at eye level, you have to bend a bit to read it. Where the urine stops at the top and the number around that which the urine stops, that is the specific gravity of this urine. So the specific gravity of this urine is 1.020. So that means that the specific gravity of this urine is within normal range. That is how you can get specific gravity of urine, right? So now we have gotten the chemical, we have done the chemical examination of this urine. We've noticed that there is no glucose. Glucose is negative. The specific gravity is within normal range. So, and remember, we are doing OSCE, right? So, and we have done this urine testing according to the instruction that which has been pasted in that particular station. That is, carry out glucose tests on the specimen before you, and of which we have done that, and we have done the chemical and the physical examination. Glucose is negative. So I have to remove my glove. You know, I've touched the urine a bit, so I have to return the urine, remove the urinometer, return the urine inside the beaker. Try as much as possible to avoid contaminating your instrument. Put the urinometer inside the soapy water first, right? And rinse it in a clean water. Do the same with the test tube, right? Rinse the urinometer. Always make sure that you keep your discard use equipment after when you are done with the procedure. So the next thing is for me now also to discard the syringe that which I have used, right? So, and also rinse this because I have put used syringe inside, so I have to rinse it, isn't it? So I'm discarding used equipment. Remember, there is a mark assigned to this step. Discard used equipment, right? So I'm trying to read. Don't forget that during OSCE, there is a next candidate that will be coming after you. So it's important that you rearrange the equipment. So you tell your examiner, I'm rearranging used equipment. I'm discarding used equipment by rearranging, right? I have rinsed the other one. I have to bring it back here. Yes, I'm discarding by rearranging because I have a next candidate. Please don't forget, whenever you are carrying out OSCE, do not scatter all the requirements when you are done, and then the next candidate will start coming and will be struggling trying to set the requirements before he or she carries out her own procedures. Please help each other during OSCE. The next is for me to discard my glove, of course. So when discarding your glove, you don't have to contaminate yourself. Remember, we have touched towards a specimen, the urine, right? So you have to pinch here, the middle of your, somewhere here, pull it, and then remove your hand, right? So I did not contaminate my hand. And the next thing, remember, you have removed this hand. It's okay since it has been inside the glove. The next thing is for you to put your index finger right under the glove, pull it this way, and then you are done. Then discard the glove. That means you haven't contaminated yourself. The next thing is for you now, the candidate, perform the last hand hygiene. You are done with the procedure and you wouldn't want to contaminate your pen and paper, right? So before we record the next chemical examination, I have to perform hand hygiene. See, I have hand hygiene, of course. and make sure I dry, because I'm going to record it on a paper. Make sure I dry my hands properly. Yes. Right. Reaction for glucose. Glucose is negative. Sorry, reaction. Have to write reaction to litmus paper or the pH. Remember, the container that I have using, it doesn't have pH, right? Oh, it does. It has pH 60 seconds, and the pH was negative, right? The pH was negative, so as a pH negative. Specific gravity 1.020. Glucose, right? Glucose negative. Pardon me. Yes, it's negative. So you record. After, when you are done, remember it's OSCE, right? Then you have to submit it to your examiner. This is my results, that which I have performed on this placement. You give to the examiner, and the examiner will record you. Of course, when you are carrying out, the examiner will keep recording your steps, each step that you do. So I've come to the end of this procedure. Please don't forget that you like, share, and subscribe to my YouTube channel. I love you all. I love you all. I love you. Please keep supporting me. Thank you for all your support. I appreciate you. Thank you. Bye-bye.